Hello, my name is Bill Robertson, and it's my privilege to serve as the President and CEO of Multicare Health System in the great state of Washington. This morning, I'm privileged to be able to be talking with Dr. Marion Couch, who's with the Regents organization, Cambia specifically, and so excited to be able to talk with her this morning. So good morning, Dr. Couch.
Hi, Bill. Great to be here.
So glad you're joining us here in the great Pacific Northwest. You've had quite a journey over the last few years, and I'm very interested in getting to talk about that with you this morning. So you have a clinical career, and then you have a career in Washington, the other Washington, and now you're out here in Oregon and Washington area. Tell me a bit about that career that has brought you to where you are here today.
Thanks, Bill. It's such a privilege to be part of Cambia Health Solutions. And I'll sort of work backward to answer your question. I most recently came from CMS, where I was the senior medical advisor in the office of the administrator. And in that role, worked across the policy creation and was part of the team that made those important decisions. It's, as you know, the world's largest purchaser of health insurance, a $1.3 trillion annual budget. And I led many projects related to, for instance, prior authorization, process improvement, maternal mortality reduction. And then most recently was involved in the response to the pandemic. And it was almost like it was two separate experiences. Prior to that, I was a trained head and neck surgeon, and really enjoyed that. I really felt so privileged to be a clinician. I've been a chairman of 2 surgical departments. I've been a physician executive in 2 medical groups and led their medical group board prior to having this time many of us do, where my twins went to college, and I needed to think about what I wanted to do with the rest of my life. For me, having a clinician at the table, figuring out how we're going to pay for healthcare is an important thing that we all need to think about, how to pay for better healthcare, better outcomes. And so after my time at CMS, I wanted to think about how I could also have a role in thinking about value-based care arrangements and improving outcomes, respecting the providers and health systems. And Cambia for me was a perfect fit.
So, well, welcome. We're glad you're out here. I think you're going to love the Pacific Northwest, and we need people who think as you do as we seek to create a more collaborative healthcare delivery system for the communities and people we're privileged to serve. So while you're with CMS, going along, life is great. It's just kind of business as usual. And then we have something called COVID that shows up in early 2020. And how did that change what you were doing, and what became your focus at that point in the work you were doing?
You know, like many of us, Bill, it is probably going to be some of the most meaningful work I've ever done in my life. It landed on CMS's doorstep on March 2nd. And I remember hearing about it and thinking, boy, that would be hard to deal with. I hope I don't have to deal with it. And on March 2nd, it was full time. And I commonly say that I became a surgical intern again. We were working around the clock. It wouldn't be uncommon to get a call from the White House and hop on a call at 10 o'clock at night. And we were problem solving. And for me, I would love to share with the viewers that the team at CMS was unbelievable. And many of you have had that experience. They pulled together, they never said no, they worked around the clock, they made it work. And we really took to heart the fact that we wanted to empower providers and health systems to do the best possible job for our beneficiaries, 145 million of them. So we stripped away regulations in an historic proportion, and that wasn't easy, to be honest. If you pull over here, you have to figure out the levers you need to pull and the impact on the rest of the system. But we really, I think, did a historic amount of deregulation during the public health emergency. And then we're starting to piece together what the post-pandemic world would look like. And a lot of that is involved with the vast expansion of telehealth. And we dealt with things like scope of practice and other issues around that. But the technology piece of that is also important. Privacy issues are also important going forward. But I just will, I think, fondly look back on that time as incredibly challenging, but deeply meaningful.
So you referenced technology in your thinking back on your time during COVID in the early days there. So the expansion of telehealth has been incredibly important, I believe, to how the U.S. healthcare system is taking care of people during the pandemic situation we're in right now. In my own organization, we went from about 20 virtual visits a day to 1,300 a day, and that happened just over just a couple of weeks. So appreciate the work that happened at CMS and with regions and other payers to pay for the services that needed to be delivered virtually. So does that last? So we're in COVID and society's changing and healthcare's changing. So what's gonna be permanent when we get through this? What kind of technological tools will we continue to use that we maybe didn't use before? What happens to the healthcare system in a post-pandemic or in the pandemic world on a permanent basis?
Well, Bill, I'm going to ask that you share with me what you think, because I don't think any of us know, but a lot of us have some ideas and a lot of us have some hopes about what will come out of this. For me, this has been an incredibly challenging time. Practices have been devastated. People have been incredibly sick. Their economic situation is precarious. We're isolated, we're alone. And I just hope, I pray, Bill, that we come out of this better, stronger, and we take what we can and build upon it. It's a moment in time. And I keep saying that because I want to keep saying that. And so I'm excited about that. I'm hopeful about that. To answer your question, I think that telehealth is a game changer. And many of us have always known and wanted to embrace that. And we had a series of obstacles. We knew that it would potentially cost more. So government agencies such as Congress were not completely willing to let agencies like CMS expand as they wish. So they were putting brakes on. And then payers were worried about it as well. And we also needed to catch up in terms of the technologies as providers to have high quality ability to see the patient, exams, shared data such as lab results, imaging, so that it was a meaningful visit. Privacy issues are also a big deal. So going forward, I think because we had to, we've answered some of those questions. Providers have built systems, payers have invested in technology platforms for things such as telehealth. And now we have to figure out what constitutes high value, high quality telehealth care, because not all of it was. If I'm remembering right, we had 165 flexibilities that were given during the pandemic. A lot of that around telehealth. And we have to figure out now what we want to put back together. And what does that process look like, Bill? I don't know. But I know we will never go back to the way we were. Telehealth has increased access. It's made, for instance, the amount of missed appointments, no-shows go way down. It, as a wonderful example, has made behavioral health specialists very efficient and reduced the stigmata of going to a behavioral health specialist. And those are great things. But we expanded it so much, we have to now figure out what is going to be useful. As an example, we allowed for high-level emergency department visits. And I'm not convinced, and many of us are convinced, that that's what we want to do going forward. So we'll figure that out. Knowing what standards are going forward so that we can share data is going to be important for all of us. Overall, I think we view providers as partners more and more. There's a blurring of the boundaries between payers and partners. We have to work together. You have challenges, payers are going to have challenges, and if we don't work together on this, we won't do the right thing. We won't get it right. So I think it's altered the fundamental relationship between payers and providers. And in that overlapping area is where we're going to get good healthcare delivery systems. We're going to know how technology can aid that, and we'll get it right. But we'll only get it right if we work with payers and providers to ask what they need, what they want, what they think will work.
You know, I've said during this pandemic that crisis accelerates inevitable change. And we have seen that in all kinds of interesting ways in society, I think. So healthcare is going to change, some of it permanently, some of it we don't yet know where it's going to be. What's going to, do you think, might be happening, though, from a societal perspective because of the pandemic changes that we've experienced? I mean, you know, are kids always going to be virtual at school? There's a whole set of things. Any ideas about how society may sort itself out differently?
You know, that's a great question, and I'm watching. I think we have to be kinder and more connected and figure that out, Bill. I worry about isolation, loneliness. In terms of healthcare, I think we want to consider how to keep people at home. Perhaps we've learned that institutionalizing people when we could have an option to keep them at home and connected with their families is not a good idea. Let's keep them home. I think patients have realized that a clinician being motivated, incentivized, paid to reach out to them, to check in on them is really great. And having the ability then to feel that they can easily reach the office and get answers to their questions is really important. I've always thought that patients, and now we have to go there as providers and payers, like the concept of value-based care. It's the outcome. You know, I want this set of things from my healthcare, and now making sure that we're paying for that. So value-based care with a complete focus on better outcomes is, to me, the right way to go. And that's a whole set of different activities that maybe payers are going to pay for now, such as reaching out, calling up Marion and saying, Marion, you know, you need to come in for X, Y, and Z screening. Oh yeah, I forgot. Services such as pain management, physical therapy, a weight control nutritionist. These are the things I think patients want. And my hope is that we think about healthcare differently and just keep building upon that. In terms of society, you know, the connectiveness, using technology to connect people. I think we're going to find that that's essential because we need that. As humans, we absolutely need that. I think that's the one thing I know for sure that this pandemic has shown, is that we need to stay connected.
We're seeing inside our pediatric ER, very specifically, a dramatic increase in depression and kids showing up who are depressed or have suicidal ideations. Actually, a 400% increase from pre-pandemic to now, which would imply that we are not yet as a society supporting at least our kids in a way for the connectedness they need and the sense of security they need, and maybe the resilience they need to build in this. So it does seem that one of the things you've talked about, and it's been a thread, is that things can be better together. Collaboration makes a big difference in helping people have a better clinical outcome, obviously, but maybe a better opportunity to live a healthy life as well.
Yeah.
So one of the things that I'm always interested in is how connecting information makes a difference. So if an insurance company has information that is relevant to how a health system or a provider might better support a patient, or vice versa, how that, and it's shared, how that improves the outcomes for that individual. And I know you have ideas in that space and have been working in that space a bit. Where do you think this goes in healthcare today?
One of the aha moments I had while at CMS, Bill, was that we're asking health systems and providers, meaning physicians and nurses and their teams, to embrace value-based care. And at one of the Learning Action Network meetings I was at, one of the CMOs was candid and said, you know, we've got a value-based contract where we are assuming risk, but I don't think my providers in my area are doing anything different. And for me, that's just gambling. And as providers and health systems, we've known that we need to get into the value-based world. The fee-for-service world isn't working for us. And the pandemic showed for great groups of clinicians that it was just awful. There was no support for them during this. But the thing that you need is shared metrics, shared dashboards. So I'm like a broken record, but that was my aha moment. In order for providers not to think that they're just gambling, they need to know what the criteria are that they're going to be paid differently for. And there's a dashboard that we share, that we design together, that lets us know what we need to work on per member per month spend. What are my quality metrics performances? What sites for you do I need to go talk to make sure that they're doing better in those areas? And then look at your portfolio of value-based models, payment models, and understand which ones are performing for you, which ones are not. Those, I think, are the important learning points. For me, that was the aha moment. I would feel that I wasn't gambling, assuming risk, if I knew how I was doing on a weekly, almost daily basis. The other thing I'm trying to put forward is we need to have the provider and the health system perspective as payers. We may design a wonderful portal that you could go in and get that information. But my goodness, the number of contracts that you deal with and payers. And if I'm a provider, at one point, I think I had over 20 different plans that I accepted because I want to see patients. And if each one has a portal or two, that's chaos. So we need to figure out how to make this work in terms of shared dashboards and a minimal number of portals that people have to interact with.
I think that's really an insightful perspective. We have a great relationship with the Regents organization at Multicare, but we have other payer contracts as well. And our clinicians really need one platform to work with as opposed to, multiple. One of the things we also found is every payer seems to think their 10 or 12 or 15 metrics are the most important to look at. So when we started our value-based journey, had something like 140 different metrics that we were trying to be managed to or trying to manage to, and we've been able to narrow that down to the ones that we work with, which allows us to be more standard, to create standards in practice. And I think there's an interesting journey that we hopefully are on in healthcare, which is about standards, which is different than standardization, but help us understand a bit about how standards can make a difference in delivering the high quality value-based care that our patients and communities deserve.
Yeah, I just want to put a plug in for the Da Vinci project, which I learned about at CMS, and I'm really excited Cambia is supporting and worked with your organization on.
Yeah.
And a set of standards for documents and the way to exchange information, huge. And I think the use case that was Multicare and Cambia's first foray was around medicine reconciliation, and MedRec is really an important concept. I was working on it at CMS in terms of standards that could be shared across payers and provider networks around prior authorization, what documentation is needed, how you would exchange that, and again, minimizing the different portals. And I remain hugely interested in that work, and I think that will reduce the chaos. And it's making clinicians miserable. It is, for instance, utilization management / prior auth, as an example, is the #1 source of frustration ahead of the electronic medical record. And I'm stating the obvious, but standards will help with that. It's not the whole story, but it will help with that. And I think that the ability of payers to partner with systems to try out use cases is really exciting. So I'm a big supporter of the use of standards. I agree with what you just said.
It's interesting that sometimes we conflate standardization with standards. So we all drive on the correct side of the road, the right side of the road here in the US, but we drive different cars. So we have a standard about the side we drive on, but the vehicles can be different in that regard. And I think we have a lot of space where are not enough standards in healthcare that allow us to communicate, allow us to have visibility into what each party to the care, the patient, the insurer, the provider, has access to. I think one of the interesting spaces for health systems is we started off in many ways as hospital platforms, but we're taking responsibility now broadly for people when they're in their homes and when they're in an ambulatory setting. And we don't necessarily have the same information when they're outside of our hospitals as we have inside. And insurers have an increasing set of information the more outside the delivery system. So when someone goes to a pharmacy, we may not know, but the health plan will know. And so being able to put that together allows us to better provide resources and support of consumers and patients to keep them home, to keep them well. So it's a really interesting journey that I think we're on to a better population health management situation.
I think you're also coming into the interoperability realm with your great comments. And I think that that's essential. It's hard, tough work, but I was so proud of the administrator, Seema Virma, for really putting a stake in the ground and saying, listen, we've got to start tackling interoperability so that we can share information in those documents. And it's her story to tell, but she is personally incredibly committed to that because of a major health scare of one of her family members. And she was, as a healthcare consumer, shocked at the state of information that was given to her when she requested it. And when she then started peeling back things and realized that we're really not where we need to be, she really made that a major initiative at CMS. And I just hope we continue down that road. It's tough work, but interoperability is really, really going to be important. And I just hope all of us as providers and payers embrace that and do what's needed to get to where we need to go to share that information across the continuity of care. For a member, a patient, a beneficiary, there's a spectrum of care. And it would all be better if we could, when we needed to, share that information. That's stating the obvious, but it's not possible to do that right now.
So Regents has been investing in this. I know Cambia has had an agenda around technology platforms that aid with better connectivity, better patient care, and the like. So what kind of an agenda in your role do you get to create in working in this space? Because you bring a worldview towards that. What kind of an agenda can you create in this space for Regents, Cambia, and in collaboration with health systems?
Bill, I think my major role will be to always challenge people to think about how to simplify it, to make sure we're watching national trends, to be sure with interoperability we're embracing the great importance of using standards in everything we can, and to think about how we can get the information we need to the providers. And I know that sounds simple, but in day-to-day when I'm in conversations, to be that person that keeps challenging that, because we're undergoing an evolution as well. So I would say I've been here 3 weeks already, and I've already seen a number of areas where I'm going to be stepping up to say, okay, in terms of interoperability, how are we going to make sure that we're keeping up with what's going on in the national level, supporting it, which, by the way, the health plans and Cambia are, which I'm really, really proud I'm really glad to see that. But support this national effort, and make sure that we're partnering again with our providers and health systems to encourage them to do that as well and work with them to do that as well. Again, I'm this little gnat that's going to keep going after them to keep doing that. But the great news is we have I think, an awesome team here that's way ahead on that, way ahead on interoperability, and really leaning in on that.
So you referenced team here, and I think the idea that it takes more than just the payer side of life and more than just the health system side of life or the provider side to make this happen. We have to collaborate in a way that maybe is different than what we have seen in the past, because sometimes we have seen us as opposite sides of on opposite sides of the table from negotiations and the like. So what do you think are some of the keys to collaboration? I know we've had a great collaborative relationship with Regents as we put together systems that work in the best interest of the patients that we care for, the members. So what ideas do you have related to creating collaborations that work? Because it's not just technology, it's people in this.
I couldn't agree more, Bill. That was beautifully stated. My personal belief is that when we empower health systems and providers to share in savings, to make things more efficient and better, we're always going to get better outcomes. And one of the best examples, and I'm just being transparent, is in the space of utilization management. We both know we need to eliminate waste and reduce low value care, low value procedures. Our health system is not sustainable unless we do that. I think you're always going to get better utilization management when it's on the provider side, when they're going to be making those decisions. For me, as an example, when a payer is trying to manage and think about prior authorization, utilization management, it's never going to be as effective as when we have that responsibility on your side. So that you can go to your providers and think about how you want to do things. You're thinking about how utilization management and prior authorization, hopefully it will go away, but utilization management is done. There's, I think, significant waste in the system, and that to me is an example of payers enabling providers to do the very best they can and being responsible and accountable for it. In that way, I think providers will say, yeah, I get this concept of shared risk. I get that if I manage my patients really well and I work with my colleagues not to order unnecessary tests or low volume care, I'm not rewarded for that. Yeah, the waste is going to go down and I'll share in that. So for me, it is putting roles and responsibilities in a different way in the right place in the healthcare spectrum. And a lot of that is on the provider health system side.
One of the things that I have observed is that when people work together towards a common goal, as opposed to towards their own interests, you end up with a different outcome. And when the incentives are aligned towards meeting that common goal. So in the Regents multi-care relationship and the technology that we work together on, like Da Vinci and the like, we were seeking to achieve something for our shared member patient, and we worked together as a team to accomplish that. And we worked together so it was a win for our patients, also a win for Regents and a win for multi-care, because we each had the tools and the outcomes we were responsible for, which were viable for us both, and the patient was winning, and which is what we want ultimately, is the patient to win. So I think we're going to get to build up our muscle around collaboration if we're going to do this right, getting us all focused towards what's in the best interest of the people we serve. And I think that's a great journey to be on as partners in the health of our communities.
I agree, Bill. You know, identifying those high risk, high spend patients so we can get resources to them, that's a mutual win. So, you know, I'm stating the obvious, but I don't know that there's an abundance of examples of payer providers doing that well together. But it's absolutely in our mutual best interest to do a better job on that. But identifying populations, enabling providers to do their thing, supporting health systems. Um, I just hope we're at this moment in time where we fundamentally rethink how we're doing things. And a lot of that, just to be candid, is trust. A lot of that is a big bolus of trust has to start happening.
The board chair for Multicare Health System has said, ever since I've been here, and it's been 6.5 years, that as a community-based nonprofit, we have a moral obligation to provide the very best care in the very best way that promotes health and healing for those we serve, and to do it in a way that is economically not a burden on our communities. And I think that's the right journey to be going, and I think there's a lot of alignment from the payers community and with that kind of an approach. And our communities are better off because of it. So it's going to be, and technology, quite frankly, is going to be a big part of that, because with shared information, and then you can actually build that shared trust that you are working towards a common goal as stewards of the community's resources, quite frankly. So you have an interesting journey to be on for your career in Cambia, and you're going to hold folks to thinking about how to make things easier. So it should be easier for clinicians, and it should be easier for the consumer. And technology might be able to support that. How is easier what would make clinicians' lives easier towards achieving this value-based approach to meeting the needs of patients? What kind of things should we be thinking about to help the clinicians who we don't want burning out, who are going to have to likely see more patients over time, and we still want a great level of care? What might help clinicians have a better experience in the healthcare system?
You know, I'm going to say something a little unusual, but it's true. We need to actually ask them. We need to sit down and ask them. We need to work with their professional medical societies who have great committees, and they've thought about this deeply, and find out what they think, what they want, because they have a lot of answers to this. And what may work for one specialty may not work for another. So it's going to be a nuanced set of answers. And what may work in the state of Washington may not work in Washington, D.C. So we've got different markets that we have to deal with. But I have to tell you, one thing I'm always asking is, did you ask the providers? Because they're going to tell you, Bill, we're not shy. They're going to tell you, and they've thought about it deeply. And you know what? Some of it is really, really important, good stuff. So I would say to you, the importance of literally asking and making sure that you're not just designing something over here with, because I'm a GeekWire, really smart people that know the technology part. Start with asking the providers what's going to work for them, and they'll let you know, and then you can build upon it. So for me, the ability to automate a lot of the processes, making sure that if you're asking them to do something in a timely fashion, because medicine is 365, 24/7, we've got to keep up with that. We need to honor that. So if we're putting processes on them, we need to make sure that we're available. And a lot of that's going to be automation, I think. But if we can automate with the great use of standards, ask them what they want and listen, share dashboards, I think we're going to make giant steps forward. And those are really simple concepts, but not a lot of it has been done in my mind. So that's the way I would approach it. And I know I'm stating the obvious, but I'm telling you, I think it's huge that we start by asking the clinicians and the people in health systems in that area what they want.
So when we ask clinicians, in my experience is you actually get really important answers. And many of our technology platforms that are maybe increasingly legacy were built around other requirements. They were built around revenue cycle requirements or infrastructure that was made sense for a health system, but maybe not for the clinician. And we turned clinicians into very expensive, would say not always very good at it, data entry personnel. And it isn't the highest use of that limited, valuable resource. So I think it's going to be interesting to see how we're able to listen better and then use the tools of technology. AI is going to be an increasingly important part of how we enable clinicians with information more at their fingertips, I think, and a common standard platform. It's just going to be a really, really interesting journey ahead. So we're coming towards the end of our opportunity to talk today. So there's challenges, there's problems in society, COVID's still with us, but most people are getting up and putting one foot in front of the other and making life happen. So what causes you to be hopeful and positive about the future?
No, Bill, and I want to make sure you answer that question too, because I'm eager to hear from your perspective what you think. I am really hopeful. I'm really excited. We, more than any other time in my career, and it's at this point been a long career, have the ability to change things. We've undergone this phenomenal experience with the pandemic, and providers like me never thought we wouldn't have a job to do. We always thought we'd always be able to get up and come to work. We were protected economically. And so many of us are just completely struggling. And out of that, I hope we are going to embrace change. In other words, what the fee-for-service world would look like isn't very attractive to us anymore. And we've clung to it for security reasons. So my hope is we are absolutely at a moment in time when we can embrace new ideas, understand that we want to partner more. America expects more. All these things are coming together. So we have the ability to build things in a moment in time now better than if this hadn't happened. So I hate that we're going through this. This is hard on all of us. But I am extremely hopeful that we're going to come out the other end being able to embrace new ways of delivering healthcare, paying for it, and expecting better outcomes. And I don't think like telehealth, I don't think it would have happened if we'd not endured this pandemic. So I think the silver lining of this and why I'm so hopeful is we'll be able to think about value-based care, automation, standards, new ways of doing things, partnerships in ways that we never would have before. And it's a burning platform. We've created a burning platform for change. And that makes me very, very hopeful.
Well, I love the fact that you're hopeful. I am hopeful because human beings have demonstrated an infinite capacity to figure out how to continue moving forward. And I think that you combine the fact that we have incentive now and the creative capacity of human beings and the power of collaboration, we can create a better future for our communities and the patients that we're entrusted with. So, well, thank you for spending the last 40 minutes with me. I look forward to working with you as we, together with Regents and Cambia and other partners in the community, seek to better care for the communities that we have. So great seeing you today.
Thank you, Bill. I enjoyed this very much. Have a great day.
You too.